Phlebotomy mock exam. Question 1. Which action is correct if a patient experiences syncope? Option A, lower patient to supine. Option B, leave patient standing. Option C, continue venipuncture. Option D, apply tourniquet titer. The correct answer is option A, lower patient to supine. Syncope requires immediate needle removal and lowering the patient to a supine, flat position to restore cerebral blood flow. Leaving the patient standing or continuing the draw risks serious fall injury and worsens the vasovagal episode. Question 2. The abbreviation STAT means: Option A, standard time. Option B, immediately. Option C, soon after tomorrow. Option D, scheduled test. The correct answer is option B, immediately. Stat is derived from the Latin statim, meaning immediately. Stat orders require specimen collection and processing with the highest priority, typically within 30 to 60 minutes, and are designated for critically ill or time-sensitive clinical situations. Question 3. Which tube is used for lipid panel? Option A, red or serum separator. Option B, light blue. Option C, lavender. Option D, gray. The correct answer is option A, red or serum separator. Lipid panels are performed on serum or plasma, making red top or serum separator tubes, SSD, the standard collection tubes. Light blue tubes are reserved for coagulation studies, and gray tubes are for glucose-related testing. Question 4. Blood cultures should be collected. Option A, without cleaning site. Option B, after alcohol and antiseptic. Option C, after routine tubes. Option D, in any order. The correct answer is option B, after alcohol and antiseptic. Blood cultures require rigorous two-step site preparation with 70% alcohol followed by chlorhexidine or iodine to minimize contamination. Blood cultures are collected first in the order of draw, before any other tubes, to prevent contamination from additives. Question 5. The first step after identifying the patient is to: Option A, apply tourniquet. Option B, wash hands. Option C, prepare equipment. Option D, ask for allergy history. The correct answer is option B, wash hands. After patient identification, hand hygiene must be performed before any patient contact or equipment preparation. This sequence prevents pathogen transmission and complies with infection control standards. Skipping hand hygiene is a significant safety violation. Question 6. A patient with known fainting history should be: Option A, placed in supine position. Option B, allowed to stand. Option C, told to flex arm. Option D, asked to walk around. The correct answer is option A, placed in supine position. Patients with a history of syncope should be placed supine, lying flat, before venipuncture to prevent falls and injury if vasovagal response occurs. This is a proactive safety measure that does not require waiting for symptoms to appear. Question 7. If blood is drawn above and for: Option A, results may be diluted. Option B, results are more accurate. Option C, patient experiences no risk. Option D, it's preferred. The correct answer is option A, results may be diluted. Drawing above an active for site introduces for fluid into the specimen, diluting analytes and producing falsely low results. If the same arm must be used, the for should be stopped for at least 2 minutes and blood drawn below the for site after discarding the first 5 ml. Question 8. What does OSHA require phlebotomists to wear when there is potential exposure to blood? Option A, shoe covers. Option B, lead apron. Option C, personal protective equipment. Option D, surgical mask only. The correct answer is option C, personal protective equipment. OSHA's blood-borne pathogen standard mandates use of appropriate personal protective equipment, PPE, including gloves, gown, mask, and eye protection when exposure to blood or body fluids is anticipated. Gloves alone are insufficient PPE in high-exposure scenarios. Question 9. The phlebotomist should collect a specimen for glucose analysis. Option A, after eating. Option B, with no fasting. Option C, according to physician order. Option D, always in the evening. The correct answer is option C, according to physician order. Glucose specimen collection should always follow the physician's order, which may specify fasting, random, 2-hour postprandial, or timed draws. No blanket rule applies. Collecting without following the order can lead to clinically misleading results. Question 10. Labeling specimens should be done. Option A, before collection. Option B, while patient waits in reception. Option C, at the patient's side after collection. Option D, at the end of the day. The correct answer is option C, at the patient's side after collection. Specimens must be labeled immediately at the patient's bedside after collection, while the phlebotomist can directly verify patient identity. Pre-labeling or delayed labeling significantly increases the risk of mislabeling and patient safety errors. Question 11. The antiseptic used for blood culture site preparation is: option A, alcohol only. Option B, iodine or chlorhexidine. Option C, saline. Option D, hydrogen peroxide. The correct answer is option B, iodine or chlorhexidine. Blood culture collection requires rigorous antiseptic preparation using povidone iodine or chlorhexidine gluconate to minimize contamination risk. Alcohol alone is insufficient for blood cultures due to its limited activity against skin flora in deeper layers. Question 12. Which is a proper way to identify a patient? Option A, ask name only. Option B, ask date of birth and check ID band. Option C, ask room number. Option D, ask visitor to confirm. The correct answer is option B, ask date of birth and check ID band. To identify a verification, asking the patient to state their full name and date of birth, and confirming against the ID band, is the required standard. Room number is location-based and can change. Visitor confirmation is unreliable and non-compliant with safety standards. Question 13. Which is most important before performing venipuncture? Option A, confirm patient identity. Option B, tourniquet application. Option C, tube selection. Option D, site cleansing. The correct answer is option A, confirm patient identity. Patient identity verification using two identifiers is the single most critical safety step before any specimen collection procedure. Collecting from the wrong patient is a catastrophic error with potentially fatal consequences. All other steps follow identity confirmation. Question 14. A tourniquet should not be left on a patient for more than how many seconds? Option A, 30 seconds. Option B, 60 seconds. Option C, 90 seconds. Option D, 120 seconds. The correct answer is option B, 60 seconds. CLSI guidelines recommend the tourniquet be applied for no more than 60 seconds to prevent hemoconcentration, which can falsely elevate results for proteins, cells, and other analytes. Prolonged tourniquet application causes stasis and alters sample integrity. Question 15. The additive in a serum separator tube is: option A, EDTA. Option B, heparin. Option C, clot activator. Option D, citrate. The correct answer is option C, clot activator. Serum separator tubes, SST/gold top, contain a clot activator, thrombin or silica particles, that accelerates clot formation, along with a gel that separates serum from cells after centrifugation. They do not contain anticoagulants like EDTA or heparin. Question 16. Which tube prevents clotting by binding calcium? Option A, serum separator. Option B, EDTA. Option C, citrate. Option D, heparin. The correct answer is option B, EDTA. EDTA, ethylenediamine tetracetic acid, prevents coagulation by chelating, binding, calcium ions, which are essential cofactors in the clotting cascade. Heparin inhibits thrombin activity rather than chelating calcium, and citrate also chelates calcium but is used specifically for coagulation studies. Question 17. What is CLIA? Option A hospital association. Option B, regulatory standards for lab testing. Option C, a nursing credential. Option D, a phlebotomy technique. The correct answer is option B, regulatory standards for lab testing. CLIA, Clinical Laboratory Improvement Amendments establishes federal regulatory standards for all clinical laboratory testing performed on human specimens to ensure accuracy, reliability, and timeliness of results. All labs performing patient testing must meet CLIA requirements. Question 18. What is a common use of fingerstick blood? Option A, CBC. Option B, blood glucose. Option C, blood culture. Option D, coagulation studies. The correct answer is option B, blood glucose. Point-of-care blood glucose monitoring is the most common clinical use of fingerstick capillary blood. Blood cultures require sterile venous samples, coagulation studies need precise venous volumes, and while CBC can be done on capillary blood, it is not the most common fingerstick use. Question 19. If a patient has an 4 in both arms, the phlebotomist should: Option A, draw below 1/4. Option B, draw from fourth site anyway. Option C, seek assistance for alternate site. Option D, draw from foot. The correct answer is option C, seek assistance for alternate site. When both arms have active force, the phlebotomist should consult the nurse or physician to identify an appropriate alternate collection site such as the hand or wrist. Drawing from or below an fourth site can result in diluted or contaminated specimens. Question 20. Which is a sign of infection at venipuncture site? Option A, swelling, redness, warmth. Option B, bruising only. Option C, slight discomfort. Option D, temporary pallor. The correct answer is option A, swelling, redness, warmth. Classic signs of localized infection: swelling, tumor, redness, rubber, warmth, calor, and pain, dolor, at the venipuncture site indicate an inflammatory or infectious process requiring prompt medical attention. Bruising and temporary pallor are common non-infectious responses.